Welcome to Unscripted. I'm your host, Addison Uehling. On today's episode, we will be sitting down with Dr. Mike Smith. Dr. Smith is a member of the healthcare improv team and has years of experience practicing, performing, and teaching improv through Omaha's backline comedy theater and around the country. Dr. Smith's belief is that improv is a valuable tool for helping improve communication and make life more joy-filled. Realizing early on that his skills learned through improv could help him as a hospitalist, Mike began implementing those around work. The result was more enjoyable work, better interactions with patients, and more effective teaching. Join us as we explore the seemingly unlikely pairing of improv and healthcare on today's episode of Unscripted. Well, thank you so much for joining us today, Dr. Smith. Can you start by introducing just yourself and kind of telling us a little bit about you?
Sure. So my name is Mike Smith. I'm an academic hospitalist at the University of Nebraska. I also teach, perform, and watch improv at the Backline Theater in Omaha. And then I run a website called healthcareimprov.com that is my thoughts on the blending of those two worlds.
Awesome. Well, what inspired you to go into the medical field?
I would have to say my family. They, all my siblings are 10 to 19 years older than I am. And so I got to see what they did with their lives and got to kind of pick and choose. And I had a brother that's a lawyer, and I have a brother that's a doctor, and I was always kind of more into math, science, that field. And so that's the route I chose. Cool.
So what kind of made you choose your specialty?
Yeah, so my brother that is a doctor, he's a radiologist, and so I was kind of marching down that path because it seemed he enjoyed it.
Yeah.
It is not my personality at all, though. So I went with internal medicine because it suits kind of my strengths much more.
Okay, awesome. That's super cool. So you say you do medical improv. Kind of what is that? Can you explain that to the audience?
Sure. So medical improv falls under the umbrella of applied improv. And so that's taking the skills, exercises, and practices from improv theater and then applying it to a new context. And so improv theater is anything that's made up on the spot. It got its start in America, at least in the early 1900s in Chicago. There's a woman named Viola Spolin who did it with immigrant children and played games. And so it was a way to help them integrate into society in a way. And then her son kind of pioneered the idea of using it as a way to build material for scripted productions. And then eventually it became people want to watch the process happen. And so it's kind of taken those various forms since then. Mm-hmm. And medical improv is basically going back to those games that Viola Spolin started. And using it to kind of build creative ideas and creativity and a lot of the communication principles that are so essential to the medical practice.
Yeah. What kind of sparked your interest in improv?
Yeah, so it was kind of sparked upon me, if that makes sense. My wife got me improv lessons for Christmas one year. Oh. Prior to that, I never had any theater experience. That Christmas, we had just moved back to Omaha, and we lived in New Orleans at the time, and I didn't really want to move back to Omaha, despite us both being from here. But I was outvoted, and so I tore my ACL as well. My main activity prior to that was playing sports, and that was kind of taken away from me. And I was kind of mopey about moving to Omaha. It was great that I did. I was very happy with it. But at the time, I was not seeing the light. And so that Christmas, she got me improv lessons, and I kind of just started doing it. And I didn't really tell anyone at work that I was doing improv. I kind of was a little shy about it. Then I started doing some of the skills from improv class at work, which a lot of people give me a weird look when I say that. It wasn't like I was taking patients out into the hallway and making them do stuff with me. It was more the skills practiced in improv class. How do I practice that skill at work? And so that's there's an exercise called a 3-line opener where you come out on stage without knowing what you're going to say, and the other person doesn't know either. And so within 3 lines, you kind of have to establish who you are with each other and go from there. My patients in the hospital are in kind of a similar position in that they're vulnerable and they meet hundreds of people and they don't know who this person is versus that person is. And so if I really focused that start of the conversation on connecting with them, on what's important with them and what my role is, it just made all of our interactions go much better, starting from that place of connection. Yeah. And as I was doing that, my patient satisfaction scores improved more than anyone else in my group. So I was like, yeah, look at that. And so I was very excited about it, but I was also kind of like, well, I thought I was good at these skills already. And so just that awareness of practicing those skills in the improv stage made me practice it in my job, and then gave me opportunities to seek continued improvement.
So it's kind of like a great like training aspect, almost to learn the skills and then to be able to apply them into your situation. Does that sound right?
Yeah, that's exactly right. There's a guy named Eduardo Briceño who has a TED Talk. It's titled How to Get Better at the Things You Care About. In it, he talks about a performance zone and a learning zone. And as physicians and pretty much anyone in the healthcare field, you spend all of your time in the performance zone. And so there's not really a good opportunity to take a risk or get better at these skills. And you only have these big seminal moments that serve as learning points, as opposed to the improv stage, which is very much a learning zone and feels high stakes. Most people kind of get antsy about it. So it has all the feeling of high stakes, but it's actually very low stakes. And so you get to practice those skills of connection, communication, listening, in an environment where there's no actual consequences.
Yeah. That's super cool. So how do you feel like a resident or fellow could like apply this to their life?
Yeah, so there's varying levels of improv training, and I think they all help. And no matter where someone's at, I think it could benefit them. The big rule or idea of improv is saying yes and so that it's just two words, but it has big implications in my opinion. And so the idea of saying yes to a person or a situation can be a lot more challenging than it would seem. And kind of suspending your beliefs just for a moment to try to understand another person can be very difficult or challenging or not at the front of mind in the busy life of a resident or fellow. And then also the and part is very important because you have to add to that reality. And so it's not just doing whatever whoever you're talking to says. It's not like you have to go around and do whatever people say. It's you're saying yes, that is that person's reality, and you're adding to it in a way that you create a reality together.
Okay, awesome. Do you feel like this helps like improve communication skills between medical professionals?
Yeah. So every medical professional, and then even within physician specialty, they all have a different perspective, and it's inculcated in their training. And so just that step two, I want to understand your perspective to get the best result for the patient, can really allow both perspectives to thrive in service of what's best for the patient or what's the team's mission.
Yeah. So with like higher communication levels, do you feel like there is a way to respond? This helps in high pressure situations within training or attending?
Yeah. So that's kind of the main thing that I push in the improv workshops that I run, that improv training, especially medical improv, is not about making you funnier. It's not about turning introverts into extroverts or changing people in any way, shape, or form. It's also not about teaching people to laugh at serious situations. There's a quote attributed to an ancient Greek man, we don't rise to the level of our expectations, we fall to the level of our training. And so in those high pressure situations, when you need these high stakes skills, it's not going to magically come to you because you want it to. It's going to come to you because you've practiced it. And so far, improv is the most fun way I've found to practice those skills.
Yeah, for sure. That's super cool. Do you have any examples of how you've used it or how it's come in really handy for you?
Yeah. Endless. I could talk for the rest of the day, but I'll keep it to a few examples. And so I work with a team of medical students and residents in the hospital. And so just building a team atmosphere, the idea of yes and understanding everyone and appreciating everyone's input, again, to increase the educational environment. I think improv has been essential in helping me do that as best I can. Yeah. And then when I failed, it's also helped me to figure out how I failed and to get better. Mm-hmm. And then there's also a patient one time that came in for back pain, and there were some things on her chart that said she may have opioid substance disorder. And so kind of coming into the room, I was expecting a discussion about not prescribing opioids and maybe something confrontational. And I applied the principle of yes and, so I had to understand her reality that she was in a lot of pain. And then I had to add my part to that, which was I do want to control your pain. And so I just listened to her and I responded in a yes and way. And she's like, yeah, okay, you listened to me, so we'll go with your plan. And I was like, oh, okay. And so it took something that may have been a contentious encounter into something that was very positive. And she trusted me and the team more as a result of using those improv principles that I didn't come into the encounter to say, I'm going to listen to her and I'm going to yes and her. It's just that I've been practicing improv so frequently that I think it's raised my baseline starting point. So yeah. I'm not perfect by any means, but it definitely helps.
It definitely helps. Yeah, definitely. Have you encountered any challenges with using medical improv?
Yeah. So I've encountered challenges both within myself. As I said, I didn't really tell my coworkers that I did it because I don't know what I thought. It's kind of a different hobby for a professional, admittedly. And so when I first, in a public setting, told people that I did improv and I'm using it to help me as a physician, that night I was like, oh God, what have I done? They're all making fun of me. And so overcoming that kind of inner challenge has helped me kind of be more confident to get the idea out there. And then also kind of interpersonally with teams, there are people who are hesitant that will say, oh, I can't do that, or I'm not this, that, or the other thing, and it doesn't apply to me. And so that's certainly a challenge that as I said, I kind of had similar experience, my initial thoughts on that. And so that's something that I think can be overcome. And once people see that there's joy and laughter at the end of it, and putting yourself out there is worth the effort, that can be overcome. And then organizationally, like trying to put on improv experiences for other healthcare professionals, that there are kind of three groups of people that I interact with. They're the people who are automatically on board. They're like, yes, I love improv. That sounds fun. I have needed those people, and there are a lot of them at UNMC who've kind of supported and said, yeah, let's do this. There are also people who are like, no, absolutely not. Under no uncertain terms will I ever participate in that. And I appreciate them and don't fault them for that by any means. The majority of the people are in the middle, where they'll say, yeah, we can do it, but what's the proven benefit? Or can you show me how this has been done at other places? Most of the people are in there, and I've had enough of those conversations that it's really helped hone what I do or in each improv experience to make sure that people will, if they're in that middle camp, they'll go over there. And even some of the people who are in the never camp, maybe they get to the, well, if you show me camp.
Yeah, absolutely. So how do you feel like the principles of medical improv kind of align with patient-centered care?
Yeah, I think it's a way to practice true patient-centered care. I think there's a study in JAMA that said hospitals with the highest patient satisfaction score actually had a higher mortality and more expensive costs. And so that to me is not necessarily care. And then kind of what we think of more the paternalistic style of medicine, I think that has a whole host of bad things associated with it. And so to me, patient-centered care is literally saying yes and to your patient, where you're saying yes to whatever their reality is. And even if you don't agree with it, you can understand it. And then that sense of care comes from what you add to it. And so you're building upon their reality, and so you make a reality together. So yes and is a way to make sure that the patient is at the center of your care decisions, and you're providing your expertise that you've spent all those years developing.
Yeah, so basically if you had a room full of residents or fellows, what would you want them to take away from this whole time?
Yeah, the biggest thing that improv has helped with is the idea of yes and. In improv, they say there are no mistakes, and so that's not necessarily true in the healthcare field. There are definitely mistakes, and there are mistakes in improv too. It's kind of what's done after the mistake happens. Yeah. On an improv stage, making a mistake is an opportunity to have fun. A lot of times it'll take a scene somewhere even more interesting or more fun. And mistakes in healthcare are bound to happen. And so the way that we're educated, it's all multiple choice tests, and we're graded on very fixed games, so to speak. They're winners, they're losers. And but once you get out into practice and residency fellow, it's much more having a conversation, being with someone, being present, and using all those things from your education. But it's more of an infant game to keep getting better and keep improving. And so the idea that there are no mistakes can be challenging, but based on how we're educated. But I think that makes a career in medicine fulfilling, because you can keep trying to grow and keep learning and keep improving, as opposed to seeing a mistake as a fatal flaw or something where you've completely failed.
For sure. So you've kind of mentioned the yes and quite a bit, and that's such like applicable thing that you can do in your everyday life as an attending physician. Can you talk a little bit more about your workshop and how our audience could find some of your resources that could help them apply the medical improv to their daily life?
Sure. So my website is healthcareimprov.com, and that just has all the offerings that I do as far as workshops that I've done in the past. But what's most exciting to me is putting together a unique workshop for someone's or a group's unique needs, because everyone kind of has a different idea of what they expect. Some people want more funny laughter, kind of a wellness type experience, and some people want more this communication or leadership experience. And so that's on the website, and then all my social media has a little more day-to-day updates, and I think most of them are HCare Improv for the handle. Yeah,
we'll definitely put that in the link below. And then, thank you so much for your time. Do you have anything else you'd like to add?
No, if you're thinking about taking an improv class, say yes, go for it. Yes. It was thrust upon me, and it's been one of the best decisions or my wife's best decisions. And she regretted it initially, because I was constantly doing improv. And so she's like, you're off to improv again. But once she saw how much it helped me and helped me as a communicator, she's now back on board. So
awesome.
She's glad she got me the gift.
Yeah. Well, thank you so much again for your time. Thank you for joining us on today's episode of Unscripted. Today we talked to Dr. Mike Smith about how improv can be a useful tool in the medical field. If you enjoyed today's show, please make sure you like, subscribe, and share so you'll never miss an episode. I'm your host, Addison Uehling, and this is Unscripted.